Hey guys, so new semester, new year, new decade, so many new things that are happening. And I'm just going to kind of take this time to really kind of reflect on manual therapies, especially as I begin my manual therapy course, my first manual therapy course. Kind of discussing kind of my education, my experience, and kind of the way that I integrate it right now into my clinical practice. So, how was I taught different techniques? At San Diego State, we were pretty big on kind of PNF patterns. So that is definitely one thing that if you weren't doing it PNF style, you couldn't call it PNF. So that's one thing that I do integrate right now. I do a lot of like slow reversal technique, a lot of contract relax for stretching, things like that. So that is something that I integrate currently right now. I do see success with it, especially when I'm doing my stretching techniques and things like that. I find that taking the time to not just have the patients do a static stretch and I'm with them and kind of talking, during that time we talk about their goals and things like that, or maybe how they're since their last visit, how they've been doing. So I do like doing that, and then doing kind of slow reversals for kind of muscle reeducation, especially early on, kind of in their early rehab and things like that to try to get muscle reactivation. I kind of use it within that. In addition, I kind of also use, I'm not ART certified or anything like that. I do kind of manual therapy. I don't know exactly the terminology, but I don't say I'm ART certified. But, and we also have Grass Tech, which is not Graston, but it's a different, form of scraping tools that we have through, and I also went through kind of like a Hawk Grips, but I didn't purchase the Hawk Grips. So I use that depending on trying to break up scar tissue. That's kind of more or less a lot of my kind of chronic patients that might kind of have some scar tissue buildup or things like that. I'll kind of go ahead and use that. And then what else do I use? PNF, Grass Tech, manual release techniques. If I do use Grass Tech or anything like that, I will usually do an active motion as well. So I'll kind of put the muscle belly on stretch and things like that with active motion. I'm kind of bigger into active motion than passive range of motion. And then I have not integrated any manipulations. I've done that with friends as like kind of like a learning kind of thing. I've done it with other colleagues, but I've never really done it with patients, especially when it comes to manipulations. I think one thing being in the state of California and not really having a licensure, I'm hesitant on how to integrate things because we don't have a licensure. And that was one thing that was really pushed really hard in my undergrad was, we're not allowed to do grade 5 manipulations, things like that. If it happened, although we weren't actively trying to make it happen. So, that's kind of one thing that I think is a little bit more different. And I think hopefully talking with other athletic trainers, especially in the state of California, with not having that licensure, and hopefully in the next year we'll get that changed. But that is one thing that I think I'm hesitant about when it comes to manipulations. And then the other thing is, what kind of successes or barriers? I think one thing for sure is I only get to see my patients, and I'm just going to stop right there. It's that barrier of change, right? Integrating and implementing change, and I can sit here and make different excuses and things like that, but I can say I only see them, 10 to 14 days, or I only get 30 minutes with them, and I'd rather use that time to do exercises. So I'm just going to actually stop because I know that I'm going to go into a tangent that really isn't that important because I'm just trying to possibly that barrier of again implementing change. So that I think that is one of the challenges though for me is time. I only get to see them time within treatments. I only get to see them like 10 to 14 days, and I only get 30 minutes with them. So I sometimes think about, I can show them something different than doing manual therapy, or if they show up 10 minutes late, I only have 15, 20 minutes with them, determining, or you never know when they're going to leave. But again, I think that can kind of be reflective on implementing change. So I'm super excited for this course. I'm excited to kind of learn more about manual therapies. I think it's definitely one of my weak points as an athletic trainer, and I'm excited to change that and implement and try new things.